Hello everyone and welcome to Public Health History. I recently visited the Sulabh International Museum of Toilets in Delhi, where I was fortunate to meet with the curator, Narjis Ali, and she agreed to a short interview.
Hello. My name is Narjis Ali, and I'm working for this organization, Sulabh International Museum of Toilets, as a curator.
We will come back to Narjis a bit later. Let's start by having a look around. There are a couple of interconnected histories here. Firstly, there's the International Museum of Toilets itself, which, as the name implies, presents the history of toilets over the past 4,500 years. Then there's a second museum, which promotes the philosophy and goals of the Sulabh organization and the sanitation system developed by the late Bindeshwar Pathak. The organization has played a key role in advancing the spread of sanitation across India over the past 5 decades. So let's start with the Toilet Museum. It's quirky and fun, designed to capture interest while building awareness of the importance of sanitation. It features a range of photographs, detailed text explanations and cartoons, as well as replicas and working examples of toilets, mostly from the recent past. The museum is divided into 3 main sections: ancient, medieval, and the 19th and 20th century emergence of modern toilets. The collection is the result of an initial call to foreign embassies in India for contributions, with about 70 embassies and high commissions providing stories and material donations. The ancient section begins with the archaeological evidence of early sanitation infrastructure at sites of the Harappan or Indus Valley civilization, such as Mohenjo-daro in the Indus Valley Basin in present-day Pakistan, and Dholavira in Gujarat, India. Archaeologists excavating Dholavira uncovered a network of reservoirs, wells, underground drainage systems and private bathing areas, mostly constructed during the mature Harappan phase of 2600 to 1900 BC, more than 4,000 years ago. There are also some early instructions on Indian toilet etiquette from the Manusmriti in the 2nd century, on how married and unmarried celibate people should use the toilet differently, including which chants to use prior to defecation, which direction to face, north if you're married, and which hand to wipe with. For the unmarried, there are very strict instructions on washing the key bodily parts involved. There is also some very practical advice on protecting water sources. Urination ought to be done at least a distance of 10 handspans from the source of water. Defecation to be done at a distance of 100 hands from the source of water. Thus we see how societies embodied public health knowledge in traditional cultural and religious beliefs. While there's an understandable focus on India and its enormous early contributions to the development of sanitation, a lot of the collection comprises images of various toilets around the world, showing how different cultures have deployed sanitation technologies to improve health, deal with human waste, and reduce unpleasant odours. The museum highlights these remarkable developments, though it perhaps omits some earlier examples of sanitation found elsewhere, such as the Neolithic settlement of Skara Brae in Scotland, where stone-built drains and possible indoor latrines have also been identified. I hope to look at Skara Brae in a future episode. The medieval and early modern section highlights the development of toilets, bathing and sanitation over the centuries. It includes the basic reproduction of a throne toilet, built for the French King Louis XIV. The lid was designed to be raised to allow the completion of business in a hidden commode underneath, with minimal interruption to the business of state. This could then be emptied later. While I've not been able to locate the original model or source texts on which this throne commode is based, it is widely documented that Louis XIV suffered from constipation and chronic bowel issues, as shown in a famous scene in Season 2 of Outlander, with the king struggling to produce in front of the whole court on a rather more elaborate throne than the one I found in the Sulabh collection. The museum collection also features a commode card table, so that the game could continue with only limited interruption. Commode nightstands and chairs were not uncommon for the wealthy in the 19th century. However, this is the first time I've seen one designed for use in company. I'm not quite sure how the card game would proceed, with a number 2 simmering away just below the table surface. More recent contributions include early portaloos, camping toilets, and some of the more contemporary Japanese innovations. There is also a large collection of toilet-related humour, including a complaint letter from a train passenger who got caught short while answering a call of nature during a stop. The poor fellow heard the guard's whistle, warning of the train's imminent departure, and unintentionally exposed himself to a whole trainload of people while running back to his carriage. Through engaging humour, images and storytelling, the museum uses history to advance the importance of sanitation. The other museum here is the one dedicated to promoting the work of the Sulabh organisation itself. Sulabh was founded by the late Dr. Pathak in 1970 with the goal of improving sanitation and reducing open defecation across India. According to WHO data from 2024, 3.5 billion people still lack access to safe sanitation, with 1.5 billion lacking even basic sanitation services and 8% of the world's population practicing open defecation. This is why sanitation is included in Goal 6 of the Sustainable Development Goals, and despite significant progress since the year 2000, huge investment in infrastructure would be necessary to achieve the goal by the year 2030, when the SDGs are supposed to be met. The WHO also claims that more than 1.4 million deaths, particularly those of children, could have been prevented in 2019 if they'd had access to adequate safe drinking water, sanitation and hygiene. India has seen a huge improvement over the past few decades. In 1993, 70% of the population practiced open defecation, and this had dropped to 19% by 2021. However, big disparities remain between rural and urban areas, and between the richest and poorest groups in society. Many households still share a toilet between them. So let's jump back to Narjis and her account of the late Dr. Pathak's work.
So when I talk about this whole organization firstly, so this everything was established by late Dr. Bindeshwar Pathak. He recently, couple of years, passed away, like on 15th August 2023. And when I talk about the museum, basically, so museum was established in 1992. Now, when we talk about this whole organization is established in 1970 because he wanted to help society. You know, the major issues of the societies in 1950s and 60s were your open defecation, and second, untouchability, manual scavengers, those communities who were categorized in the lower caste people in India. So he wanted to help that community and make sure that those communities should come up front and compete with the mainstream of the society and enjoy the same rights and equality how the general people do, right?
Dr. Pathak developed something called the twin pit flush compost toilet. Here's what it looks like.
So that how does it work, like two pit flush compost toilet? So two pits are properly two pits. These are not tanks, not plastered from the base. Base is always soil raw, and side by side use any material, locally available materials, whatever locally available materials are available around you. You can opt those materials and make sure that for the stability you use those materials, and make sure that you have honeycomb sized gaps side by side so that your process easily take place naturally. We don't add any kind of additional chemicals inside to convert or make sure that manure is directly being composed by naturally, in spite adding any kind of chemicals inside.
It will take 5 users or one household about 2 years to fill one pit. Then by inserting a barrier, like a piece of wood or stone, into the drain at the T intersection, you can then switch to using the other pit. Then back again after another 2 years.
So once you take out the cover, you sun dry it for 3 to 4 days. Once it's been dry, because moisture will be present, it's in soil, soil was the base. So because of the gas and heat, the moisture. So once it's been dry, anyone can dig out. You don't need any untouchables particularly to come and dug it for you. So once it's been dug out, that becomes empty. Meanwhile, the other pit fills, again block that side and use this side. So alternatively, you can use both the pits for the lifetime. And the role of pour flush. Pouring means by hand. You need to flush by hand. So the angle was the invention. 25-28 degrees, so consumes less to less amount of water.
Each flush of the toilet consumes just 1.5 to 2 litres of water.
So when we talk about community toilets, we have against in the community toilets biogas plants, where we take that human waste, and on base of that human waste, we make biogas.
The process was designed to be much more environmentally friendly and remove much of the stigmatized human element.
human wastewater is also there. So we treat that water into clean water. But when we talk about India, if we give, human wastewater treated into the drinking water, they'll not accept that taboo stigma still.
Then there's the question of the so-called scavengers, traditionally tasked with the removal of human waste from higher caste households. A key goal of Dr. Pathak in developing this system is that the undesirable work previously relegated to members of the lowest social caste is now no longer necessary. Other initiatives developed by Dr. Pathak and the Sulabh Foundation include biogas plants to generate energy from human sewage, effluent treatment plants for agricultural and cleaning purposes, and safe water distribution in areas with high levels of ground arsenic.
So that is what till the clean part we have done, like from human waste to with different several steps, taking towards the aeration, then sedimentation, sand filtration, then carbon filter,
Right.
then UV chamber, then water gets purified only till clean water that can be used for external some other uses like for mopping, irrigation, agriculture, farming, gardening, flowing into the rivers, and best again for the flushing into the public toilets or complexes so that it gets recycled.
The work of the Foundation over the past decades has led to the installation of almost 1.7 million toilets in private dwellings, mostly in India. The Foundation has also built toilets in slum areas, created a network of public toilets and baths around India, including in cities such as Delhi, and developed something called a water ATM, where fresh, safe water can be purchased at the very minimal cost of 1 rupee per litre. The organisation claims to have liberated almost 200,000 Dalits from the degrading work of sewage recovery, with opportunities instead for literacy education and vocational training, with many going on to undertake meaningful employment. As recognition of the Sulabh Foundation's work grew, Dr. Pathak became increasingly recognised for his role. According to his obituary in the Guardian newspaper, published in 2023, Dr. Pathak was born into a Brahmin family, so his life's work in addressing sanitation and establishing better systems to deal with human excrement was somewhat scandalous to the Brahmin community. His research in the 1960s towards his PhD in sociology meant he lived with the so-called untouchable scavenger families, who were tasked with cleaning up human waste. His work earned him the nickname Dr. Toilet. When asked what had made him so interested in changing the plight of India's untouchables, Dr. Pathak is reported to have replied, "When I was young, one of the many rules I had to follow was about not touching certain people. One day, out of curiosity, I touched a lady scavenger. My grandmother saw me and was so scandalized at the sin I committed that she fed me cow dung, sand, and Ganges water to purify my soul. Years later, I saw a young boy left to die in the rain after being gored by a bull. Nobody took him to the hospital because he was an untouchable." On his death in 2023, the Indian Prime Minister Narendra Modi described Dr. Pathak as a visionary who worked extensively for societal progress and empowering the downtrodden. I finished by asking Narjis about the goals of the museum, which receives up to 400 visitors a week.
Like how sanitation is important, how it plays a vital role in your life, how you should be curious towards your environment, towards your society. That's more important. If you're not going to be clean by yourself and you cannot keep your surroundings clean, that then there is no use, right? Just we get a platform to talk about, and we have chosen this subject as to just make sure that to convince people to change their mindset regarding and to make a healthy and clean green society.
For me and the Public Health History channel, the museum within a museum concept shows how the Sulabh Foundation is leveraging history to build awareness and enhance progress towards achieving its goal of worldwide access to toilets and sanitation. While the museum is serving this purpose well, it would be great to see the collection expand further and incorporate new information and items into its collection. The museum is free to enter and is open daily from 10:30 a.m. to 6 p.m. It is about a 10-minute walk from Dashratpuri station on the Delhi Metro. Thanks very much to Narjis Ali and the museum for an interesting, informative and entertaining afternoon. Thanks for listening. Don't forget to click the like button and leave a comment below. You can also click the bell button for a reminder about the next public health history video in a couple of weeks.